in the state of Maryland, wrote an op-ed in the Baltimore Sun last December and identified our program as a model program because of our emphasis. Also as a result of that work, the Maryland State Department of Education formed a work group, a task force that I was on, and as part of the master plan for early childhood education has identified these dual certification programs with particular emphasis on working in high needs communities as what the state should be working toward. So I think it was a combination of factors is number one, and not to pat ourselves on the back, and it certainly wasn't just me, but we did the right things. I mean, by engaging stakeholders in this process and being really responsive to our local communities, we earned the respect of the state, of our colleagues, our school-based colleagues, and as a result of that, that got us more attention, which ultimately led to all of these accolades. So we're very proud of that, but I think it really speaks to the importance of collaboration. It also speaks to the importance of relationship building. So because we had worked in these schools and because we solicited their input in terms of what we were doing, when issues arise now, and I think this is also a benefit of our professional development school partnerships. If there is an issue and something goes wrong with a student, all I have to do is pick up the phone, because it's faster than email, and even today, and I can talk it through with a person. Whereas before, if we didn't have those relationships, it could mean, and it has meant in the past, I don't want any more University of Maryland students, not that that ever happens, but just basically severing, not understanding, not working through it. So I think there have been a lot of benefits from this. I also in some ways want to speak to your question, Jenny, but link it back to the policy question. On our campus, and those of you who are at universities, I would imagine you have something comparable. We have a director of federal relations and a director of state relations. Those are great people to get to know. For one thing, they have great relationships with your representatives. They know their their educational legislative assistants well, so they can be particularly helpful to you if you're applying for federal grants, number one. Number two, you are viewed as a resource for them when they are looking for information in response to a constituent concern or when they're putting forth legislation.
I was just going to add, and you do want to be their go-to person because you get to present it from your bias.
Thank you. I have a question for Peter. Peter or Natalie, why didn't the screening result in more child line reports given behaviors related to sexual abuse? Do you think the screening supported disclosure?
So, why they didn't result in more reports?
Yes.
Well, a lot of the behaviors that were initially reported were not behaviors that the city or actually necessitated reporting to begin with. Like I said, the behaviors that initially prior to this program were being reported were as simple things as drawings. Like a drawing, even if it has explicit sexual, or like if it has details about genitals and if it's done by an 8-year-old, those things would have been reported. They reported everything that violated the school code. They called Childline on every single behavior. They didn't ask, even if they asked those children follow-up questions about if they had been hurt, if something had happened to them, and they said no, they declined, they still reported based on that simple drawing. So, like I said, it was not the school district that reached out to us to develop this approach. It was really the city of Philadelphia who said, we're getting all these reports. We have to look into them at some level, even if it doesn't warrant like a full reaching out to the family, but in most of the cases it did. But it was based on these things that they felt that were just simply being over-reported. So yes, I think that a lot of the times we didn't investigate, we met with families where children had endorsed or expressed behaviors that was just not reportable, but that had been erroneously reported previously to this program, and in my opinion had severely wasted resources, put a lot of burdens on families that did not need more people in their lives coming to their homes, and a lot of shame on the parents, because parents would get these calls, they would get people coming to their house based on what? A drawing. So in that sense, the program really helped, from my perspective, to lessen that burden on the families, and those things should never have been reported in the first place.
I think that brings up a good point about, are we, if we're over-identifying, are we bringing in too much attention to families, and especially if we're talking about trauma-informed schools, are we putting unnecessary negative attention on families? Inadvertently, in our spirit to help, are we then saying, look at these families, we suspect maltreatment, then is there a negative view on the families? It's a good point.
I think it also plays into some of the issues that were discussed with teachers and their lack of awareness about what is healthy childhood sexual development, as well as them feeling ill-prepared or equipped to deal with these types of behaviors. So I think what happened is you had an automatic response. As soon as a child did anything sexual, call the counselor, we need to get them into a screening, instead of them understanding the context behind the behaviors. And it also plays to that fear. When you think about this country and how we treat anything that's sexually related, there's a lot of fear, there's a lot of shame, there's a lot of stigma, and there's a lot of false assumptions about where this behavior comes from. So I think that was translated into over-reporting of problem behaviors.
Okay, thank you. We have time for one more question from the audience.
Actually,
Yes.
I just want to comment on that. As a CYS caseworker, I can tell you, I think that is fantastic because, and especially since the laws changed in 2015, we are just getting overrun with reports that even when they're coming into us, we're like, well, I don't really think this is anything, but now it's numbered, so now I have to go out and talk to this family and upset them for, okay, maybe there's this much chance that this is something, but it's probably not, and then it turns out not to be anything. So as a CYS caseworker, I can tell you that is, I love that. I wish every school district in the state did that. Thank you.
Thank you. We don't know. We'll keep fighting the good fight to figure this out. One of the things that we do right now is we do some prevention education. So that's kind of been the next phase, looking for more opportunities to get into schools. We've talked to the school district about continuing to do professional development with them, and then setting up more of a direct referral system, but also helping them connect with some of the other services that might be closer to their schools, trying to serve as an intermediary for those things.
And to fight for funding, maybe at a state level with some of these suggestions on how you can reach out to people and talk about something that was inherently very successful, but then was, cut. Or we've funded other areas of our work with the Pew Foundation and various Philadelphia entities. So I think that there's things we can do.
Okay, thank you. So at this time, we have our panel discussion and would like to invite all speakers and panelists to
Either come up here or these.
yes, to either come up here, or if we're not going to fit on the stage, we could sit on the front table. Oh, I guess I'm part of that.
Yeah, so what we're going to do is we'll have some microphones here and we'll bring them to you, okay? So you don't have to come up and stand in lines, but we want a dialogue. We want a dialogue between educators, front lines, child welfare workers, superintendents, students, and so forth who have sat through all of the discussion and all the presentations in the last few days, because we want to go away with some take-home messages that really resonate with you all as well. And I want to just start by talking about the opportunities here in Pennsylvania vis-a-vis what the caseworker just said. Pennsylvania last year, what did we have? 23 new child welfare laws passed, okay? And to a large degree, those child welfare laws resulted in what she said, an incredibly huge increase in calls to Childline, and without the right resourcing to do so. And legislators are listening, and they're listening to what the solutions might be, because child welfare, DHS now is under siege, both in terms of their caseworkers screaming that the caseloads are too high, and DHS screaming to the Children and Youth Office that they're not resourced well enough to handle this, and then everyone afraid of the liability for what happens if they don't do it. And what's not calibrated is the level of education in the community about what this problem is, including teachers and and the reality out there of what's happening to kids. So that has to be calibrated through education, and it's an opportunity to do what you talked about here. When Dr. Gregory talked about infusing trauma sensitivity in school cultures, if we had this infusion in the school cultures, teachers would know that they wouldn't have to call, right? They would know when to call. There would be this calibration that I'm talking about. And there's opportunity because Pennsylvania is structured in that we have an Office of Children and Youth who is in charge of the appropriations for things like DHS, which is child welfare, for departments of ed, for Department of Education, and for Department of Health. So all of those people could come together as those leaders and begin to structure things in the ways that you all are talking about. And we have the opportunity to do that. And what I heard over and over, and I want us to kind of coalesce around this idea, relationships, teamwork, right? Trust, right? All of these things, doing work for one another, respecting one another, breaking down communication barriers, breaking down education silos, right? Breaking down vernacular silos, right? Respecting each other's views, respecting different cultures, right? Those kinds of things coming together and then finding champions, both superintendents like Brian Bliss, right? Champions like the heads of coalitions, right? Like Joan. Champions who are our legislators. We know who they are. They're the ones that pick up the phone when we call. They're the ones that put their staffers on the problem. They're the ones that invite us to do the briefings, and they will because they want to be reelected. Especially when we bring to attention their constituents who want this. And then to bring the right research, first of all, do the right research and bring the right research that's unassailable, because there's always going to be someone in the room who wants to spend the money on something else. So you have to have better research, you have to have more passion, you have to have a bigger coalition to change that education reform in the way that you are impassioned to do so, that you know is going to help kids. So I want us to kind of take the richness that we have in the room, both in terms of you all in the audience with the ideas that are burgeoning in your heads, with the incredible resources we have up here on stage, and start a dialogue and just see how it goes. And I've started it just by saying, here's what I've heard, and can we get some reflections maybe from what others in the audience have heard, and just kind of start this dialogue. And don't be afraid. And anyone can start. Just raise your hand if you want the microphone, or up here, let's have some of you spark some conversation as well. And if you can't do it, I'll start, but I talk a lot.
I'd like to ask everyone in the room, how many of you are familiar with the Campaign for Fair School Funding? Just 3? Okay. That's a coalition of over 50 advocacy groups, and you are invited to join. Google it. Campaign for Fair School Funding, and put a PA next to it so that it doesn't go to some other state. Because working with that campaign for 2 years, I have not heard the voice of child welfare workers. And there are all kinds of advocacy groups on there. And what we have really struggled to do was to make it clear to the legislature that they must fund education in an adequate way. And that includes all these needs that we all know that have been brought to the schools. So come and join that campaign and raise Cain from your perspective. You know, bring your voice. There must be thousands of you in Pennsylvania who do your work. And the legislature has been in a big battle between whether or not to protect big business and oil interest, or whether or not to go get the money needed to fund schools. And they will only do what they know taxpayers want them to do. So that's one thing you can do, your organizations can do, is join a large coalition that's pushing for what it is you say you need and want.
One of the things that I would like to add, and I don't know that Peter and I talked about this as much as I would have liked, is underscoring the importance of involving parents in these discussions, and also extending parents some of the same graces that we are encouraged to extend to the children. Because oftentimes these children aren't coming into a traumatic environment out of nowhere. They're not having these traumatic experiences, or they're not, it's not coming out of nowhere. Usually you can find patterns within families, and so it's important for us to also try to connect parents and offer some support. Peter and I can tell you, as clinicians, whenever you practice TFCBT, there is a strong parental component. They are expected to participate in therapy. And often what you'll find is, in participating in their child's therapy, their issues come out. And so they're not able to support their child's behavior problems in school because they're having their own experiences. They're being triggered. Maybe school was difficult for them. So I think it's really important when we look at how we're treating children, we have to treat the whole system. So not just the schools, not just the teachers, also including the parents and other people who interact with children.
I hate being first. It's just being first. And I hate the microphone thing. But we have this whole issue of stigma. I mean, when we talk about childhood trauma, it falls under the umbrella of mental health. And so there's a horrible stigma associated with mental health, and so that involves parents who put up the hand and say, no, my child is completely and utterly healthy. So how can we address this issue of mental health in the schools, knowing that it's so hugely important, but then also the big issue of getting services to the children, because perhaps in the most needy of populations, there are issues of perhaps transportation, of getting the child, knowing that they rely upon the parents to provide transportation to these community-based services. So I'm just wondering if that may be something that we can have a little dialogue about.
Can I respond to that really quickly? Hi. I'm going to go second because you went first. So I feel like your comment actually goes back to my earlier comment around universal precautions. And when you embed tools and concepts and procedures that are for everybody, it does at least a little bit to mitigate that stigma. And maybe it's just at tier 1, and then at tier 2 there needs to be more identification. But when every student, regardless of classification, has a safety plan, when every classroom does a community meeting with feelings check-ins, when every staff member, teacher, custodian, superintendent has a self-care plan and receives supervision beyond just evaluation, those are the kinds of, again, universal, cultural, organizational pieces that get at those that need it most, get it to those who will need it one day, get it to those who are just having a crap day, right? And without further exasperating our society's stigma around asking for help and mental health and what it means to be classified or diagnosed or what have you. So.
I want to tell you about a video that you can find on YouTube. And I often show it in the presentations that I do, but there wasn't time today. It's about a 6-minute video. And maybe some of you have seen it. It's of a school in San Diego called the Cherokee Point School. And the principal of the school, so if you just Google Cherokee Point and then maybe put in the principal's name, which is Godwin Higa, Godwinhiga. And this is not a school that we have worked with, although we've met Principal Higa. And what you'll see in the video, I mean, he has created a trauma-sensitive school. It's an elementary school in San Diego. And I mean, he's done something that we've actually never worked with the school to do, which is to really involve the parents in the creation of the trauma-sensitive school. So you will see on the video parents talking, in Spanish about trauma and explaining it, in this video clip, and talking about their kids. And he himself, as the principal, talks about his experience of domestic violence as a child and how he still remembers the plate getting thrown against the wall, and how that made him feel as a child. And so what watching the video won't do is teach you how he did it, but you'll at least see an example. I mean, one of the things to me that's so powerful about the video is how stigma is just taken out of the picture. I mean, the whole school community is talking about the issue of trauma, even the parents and the kids. So check it out. It's very hopeful.
I could add to that two things. One, don't imagine that all cultures have a fear that recognizing their trauma is a negative stigma. Black folk don't. Hispanic people don't, because we know we're traumatized, and all we want is help. So there's that thing. And then the other thing is that when children are in school community, everybody knows anyway. If I'm running down the hall screaming and hitting people and throwing desks, all the kids know I'm hurt. So we know how to help children. I watch a lot of Dr. James Comer from the Yale Child Studies Center. And he says this over and over again. We know how to help children. Why won't we do it? And if you look into that model, it's always based on community involvement in defining the school culture and developing children as whole people. And it has never failed. So I wouldn't be that worried about stigma. I would more focus on a healthy school and a healthy community. Because children who have good guidance counselors are already going to anger management groups. If the guidance counselor hasn't been pulled off to do course input, they're going to grief groups. They're going to those places. And when teachers know the kinds of ways of interacting with children that are healing, the kids pick them up. In the classroom, the teacher is the model of the classroom character. The kids will act like the teacher acts. And then they'll take it home and they'll tell their parents, you need a timeout. Or they take home what they learn. That's how we stopped smoking in America. We taught the kids. So this is such a powerful way to get at a wounded society, that we cannot have buts. We've got to have how, and let's get at it.
I go back to what I said yesterday and today, which is, if we understand mental health symptoms as sort of an endpoint, as a sequelae of maltreatment, maybe we can sort of dig deeper in terms of what the research shows us, what are some of the mechanisms that lead to that as a result of trauma. And so maybe going back to a developmental framework as far as, what are some of these processes? So, we can, going back to the whole child understanding that these are processes that occur in every child. Not every child experiences or develops psychopathology symptoms, but if we can understand some of these processes, like emotional regulation, for example, if the child gets dysregulated, what are some of the evidence-based interventions that we can put in place, like the socio-emotional learning curriculum from PATS, for example, that might be able to be used for the whole school as a healthy child. It's sort of a promotion of healthy self-regulatory processes, and maybe everyone can learn how to take a deep breath. And if you're getting angry or you're getting upset, how can you downregulate some of that intense emotion? And so it takes us in terms of the mechanisms away from the pathology, not to downplay the importance of seeking help when you get to that level, but to really address some of those core developmental processes that we can work with, the teachers can work with.